17. Aspire is a longitudinal program geared towards providing pathways into the health sciences for students from historically excluded backgrounds. It was a great honor to be asked by Michael to introduce him today. In the 3 years that I have known him, I've come to admire him deeply. He is driven, he is transparent, he is honorable, and he is honest about his beliefs and stands firm in both his conviction and his commitment to creating a just and better world for all of us. It is quite the coincidence that his topic today is about reimagining the pre-health research experience. One of the many great things that Michael has taught me is that in order to see the changes that we so desperately want in the healthcare field and our world, we must reimagine new possibilities. We must reimagine the way we advocate for our students. We must reimagine the way our students are educated. We must reimagine how we show up in classrooms and clinics, which ultimately leads to a reimagining of our collective experiences. The same experiences that we are told are rites of passage and experiences that we are convinced are the only way to be. But to get results, you need to do new things, but first you must be brave enough to do them. Michael is an incredibly brave young man, and I applaud him for his courage. It is now my great honor to introduce you all to Dr. Michael Ioerger. Thank you.
Thank you, Aaron. And thank you, Student Council, for giving me this opportunity. I really appreciate having this platform to be able to talk about the Power Skills Lab and the work that we've been doing. I also really appreciate everybody that has joined us today on this for this presentation. Many of my friends and allies are here with us, and I really appreciate your support. It's made doing this work possible, and it's made it so that I have become the person that I think you all have wanted me to be, and have really kind of invested in my potential all along the way. So again, thank you for that. But again, as Aaron was talking about, with the focus of this presentation is really on trying to push everybody in this audience to rethink how we are approaching the pre-health research experience. The Power Skills Lab that I'm going to talk about, I think, is one model for doing that. But I think overall, as a community, we have to be thinking about better ways to be providing this type of research experience for our pre-health students. To help kind of ground this discussion and provide kind of a framework for understanding where I'm coming from in making this call, I do want to provide a little bit of background about myself. To start off with, I've been kind of playing this education game for a long time now in higher education. I didn't have it on here, but I started college full time at about 16. Actually, I was 16 at Wichita State, and ended up graduating a year early from high school before I started at Nebraska. At the University of Nebraska-Lincoln, I started out in the athletic training program. After I came out as gay, I needed to kind of switch kind of where I was in my training, and I moved over to complete a degree in psychology, and moved into graduate school at Colorado State, focusing on applied social psychology, and working on a PhD there. I transferred from Colorado State to Syracuse University, where I completed my PhD in social psychology. During the time that I was there, I also completed a joint Masters of Public Health degree program between Syracuse University and Upstate Medical University that focused on teaching me healthcare system policy and healthcare system management skills. A lot of my training, again, has really kind of centered around research, it's centered around policy, and coming here to the Ohio State University College of Medicine has given me an opportunity to, really kind of continue pursuing that type of training and that type of focus. I'm fortunate in that I am in the 3-year primary care track program, which means that I get to stay here for residency and be in the Department of Family and Community Medicine. And so again, this is something that I'm greatly kind of looking forward to kind of continuing my time here. During this kind of track of, kind of higher education experience and research experience, I've done a lot of what I feel are pretty substantive things. I've set up 2 labs from scratch, including this Power Skills Lab. I have spent time in a CDC-funded research fellowship position. I worked for 8 years teaching research methods and statistics, not only to college undergraduates, but also to medical students and residents as part of my time at Upstate Medical University. And I've been a reviewer for 6 different journals, including really focusing being like a methodological and kind of technical reviewer for one journal in particular, based on my skills and expertise in systematic search and review methodology. During my time through this kind of journey, I've had a lot of great mentors. This has included working with 7 different PI supervisors. I've also been mentored and kind of taught by 4 different department chairs, a vice chair for research for an academic medical department, a former president of an academic medical association, a hospital CEO, a law professor specialized in tort law, and a county health executive, just to, again, kind of name a few of the types of people that have really helped shape my focus and understanding of our research structures, our academic systems, and how all of the kind of pressures and kind of forces that are out there come to play and bear in terms of driving these institutions and structures forward. I've obviously, as part of this journey, produced a lot of kind of research outputs. That's included journal articles, book chapters, conference posters, but I'm also really proud of the continuing education resources I've been able to develop, the textbook resources I've been able to help develop, the community health outcomes action plan that I was able to help develop in Colorado, and then other just translational research products in various domains. I've also, had the opportunity kind of across this long journey through research to do work not only in psychology, but in sociology and public health, medicine, and like I said, now in meta science, where I really focus on systematic search and review and critically evaluating the scientific literature and finding ways to help us better understand and synthesize information. The other thing that I think is important to really address is, again, kind of who I am in this space. I'm a gay, polyamorous, mixed Indigenous, Native American man. That is a lot to say. And this is the first time I'm stringing any of those words together publicly. But I do so because it is really driven and informed who I am as I've gone through this experience in this process. I was adopted from birth by a white physician, grew up in that kind of white family, was able to, have a lot of resources and access to opportunities. That was the entire basis of me being adopted, out of the Native American community and into this family, was to be given that access to opportunity and resources. I am able to pass as white. And so, I've always been seen and treated as a white male. Most people probably even assume I'm a heterosexual white male. So I've, had all the access, opportunity, and privileges. But I've always been very acutely aware of where I come from and who I am. And this has made me very sensitive to understanding the kind of structures and pressures and kind of biases that kind of surround me as I've made it through the system, and I have become successful. And this is, I think, what really has kind of formed the foundation of the lessons that I've learned kind of to my journey through to medicine through research. First, there's an incredible number of talented, insightful, innovative people that are not making it into careers in medicine and science because of who they are. I've seen a lot of my colleagues get kind of crushed and pushed out of this system because they are different. They don't fit the mold of what their advisors are and who their advisors kind of expect them to be. They bring different insights and perspectives into this environment that are not always welcome. They, have lives that, have real challenges in them that, our academic medical systems are not really built to help students deal with. And so again, I've seen an incredible number of these people just, and my colleagues just kind of get pushed out of this space. That's also highlighted to me, where you come from and how you're perceived really matters and directly impacts the opportunities, mentorship, and cost of survival in this space. It has taken me a lot to survive and make it through this space being who I am. There's been a lot of cost in terms of, having to constantly keep my head down, my mouth shut, and, kind of my eyes forward, focusing on the goals ahead, knowing that there were bigger things that I was trying to accomplish. But as I think many of you have kind of seen in medical school, I've hit a point where I know that I have the freedom and the security now where I don't have to do that anymore. And I've taken that as an opportunity to speak up and push on changing things, because there are too many people that are being denied opportunities, mentorship, and really having the cost of survival in this space being way too high for it to be reasonable and for us to have who we need getting this education and making it into our communities and providing the service that our communities really need. The other part of this, though, is that this is not just about a few bad actors. There's policies, organizational structure, and ineffective leadership that really harm people in these spaces and promote this inequity. And that is something that I think it's really important for us all to reflect on, especially, for some of my colleagues that are out here who are making it into some of these higher positions. We really have to be thoughtful about how we push the people that are our bosses, are the people that are ahead of us, to be different about some of these things, because the institutions that we're creating, the structures that we are perpetuating, really do harm people that are coming into these spaces. One of the kind of examples of this that I bring up with my medical school pre-med mentees kind of all the time is this idea of holistic medical school admissions. The concept of holistic medical school admissions, I think, is the idea that we have to have. That is what we should be driving medical school admissions by. In my mind, that means that we first focus on, does the person in front of us have what it takes to kind of meet our mission, vision, and values of who it is that we want to train in our institution? And then second, evaluate, do they have the skills and abilities at this point in their career to be successful in this space? Doing that, taking a holistic approach, kind of balancing everything that we see from candidates, it would be wonderful if I actually saw that happening. But a lot of what I feel like I see happening in medical school admissions kind of across the country is this game of blackout bingo. What we've kind of devolved into is making it so that to get into medical school, you have to do all of the things. You have to start out by having the confidence to be a physician. You then have to complete the prerequisite coursework. You have to get good grades. You have to have a high MCAT score. You have to have strong letters of recommendation from a variety of people, including science professors. Now that we've kind of, again, moved into this holistic approach, you now have to have patient-centered clinical experience in addition to physician shadowing experience, leadership experience, and community service. You have to have compelling extracurricular activities and experiences that allow you to write some sort of unique personal statement and have a unique point of view. You then have to have strong interview and personal presentation skills, all to get into this space. And that is on top of finding research experience and completing research experience. And so you can imagine, for the people that are coming into this space, that's a lot to have to do. I understand kind of why we want to have research experience as a core thing for a lot of our medical students. Kind of if we look at this chart of the different pre-professional competencies from the AAMC and kind of how research experience can play into helping us understand whether or not you're meeting some of these competencies, we can see that across the board, it can contribute to helping us understand your ability to meet these competencies in a lot of different domains. However, I want you to notice that it is not the only way to demonstrate competencies in these different domains. And so again, if we're doing truly holistic review, we should be focusing on, the competencies and whether people are ready to be in this space, and not necessarily, holding people to all having to do research. I think that this is also important as we think about, ensuring that we have diverse students in these spaces, because this fishbone diagram that has been put together by myself and Thomas, who introduced me a little bit earlier, and my lab manager, Caden Gill, as we've kind of looked at this and we've started to kind of try to identify these different kind of barriers and things that get in the way of people, making it into health profession training programs. There's a lot of potential pitfalls here. There's a lot of potential places for students to get tripped up and struggle to make it to this next level. And when we look at research experience in particular, there's many of these items that contribute to, whether or not you're even able to get research experience. That includes, just the financial cost of it. A lot of research experience is unpaid. That means that you have to find time to do the work, unpaid labor. And we as medical schools right now are basically demanding our students do unpaid labor to get into medicine, right? That, again, I see that as really problematic and a way that we're perpetuating a lot of the disparities kind of among our different learners as they're going through this environment. The other kind of issue that we face in this space is that there is kind of this traditional lab structure where you have something that I think is kind of problematic because it's very PI and research enterprise focused as opposed to learner centered. Now, obviously there's some practicalities in that. There's some labs that I think have to function that way. But again, when we're thinking about research opportunities for pre-health students, and the types of experiences that we want to have and kind of why we're pushing them into that space, I think we have to ask ourselves if these types of labs are really where we want them to be. One of the things that I think is, again, kind of problematic about this focus, this PI focus, is that it really does force assimilation. PIs are looking to develop people that are essentially like them, that are, kind of trained in their way of thinking, that kind of look like them, that act like them, that do the things that they think you should do as a PI or a researcher in this space. And there's a lot of like cultural learning that comes with being a part of a research lab. And so again, there's this kind of issue of forcing students into an environment where they're being forced into assimilation. The other thing that I think is problematic here is that we're failing to really leverage the diversity of our learners, because the people that are coming into this space as undergraduate RAs are just treated as kind of cogs in the wheel. They're people that are coming in, they're doing these very kind of discrete, kind of low-level tasks. It's work that labs need to have done so that they can move forward and kind of do what they're doing. But again, they're very basic tasks that don't really give students much of an opportunity to like leverage who it is that they are and what they bring to the table to really contribute to the development of the lab. Now, again, there's some labs that are doing this better than others. So I don't want people to think that this is me making outlandish blanket statements. But in a lot of medicine research labs, this is the type of model that we are seeing, and this is something that, again, I think we really need to reflect on. The other thing that just forcing people to do research and kind of get that experience does that I think is really problematic, especially on more of like a meta science level, is that it emphasizes research output for career advancement. Everybody is trying to get the poster on their CVs or so that they can have that for medical school, or they're trying to get the poster done so they can go to the conference, or they're trying to get their name on a manuscript because, again, it will help them stand out for the admissions process. And everybody in the lab, including the primary investigators, lab managers, fellows, everybody's trying to generate this research output because that is how they move forward with their careers. The problem with that is that the focus is easy. It's easy to shift the focus away from doing good quality work and producing knowledge that really helps to move our understanding forward, as opposed to just producing product. And so I think we do a disservice to ourselves by forcing students into this space, because it can actually teach them some really bad ways of approaching science and approaching research. The other thing that it does is it perpetuates a toxic power dynamic and culture. Again, it's a very hierarchical structure. It's a structure where you rely on the people above you to give you opportunities, to give you access, to keep you around in the space. They're the people that are going to have to write the letters of recommendation to you. And a lot of people will tolerate a lot of abuse because they feel like they have to get to that next spot. For myself, when I was in graduate school, I had a lot of really like good advisors around me, a lot of people that were trying to protect me. And despite that, I still had instances where at conferences, there were senior people that were making these quid pro quo sexual advances on me that made me feel like if I ever wanted funding in this research space, like maybe I would have to give in to that. I left some areas of research because I just didn't want to deal with the people that were actually in that space in the way that they seemed to be kind of leveraging things like that for, kind of deciding where funding was going to go, deciding who was going to get fellowship opportunities, that sort of thing. Like I just didn't want to be a part of that. I also, when I was in graduate school, I was sexually assaulted, and I didn't talk to anybody about that. I didn't do anything about that because the person that did perpetrated that sexual assault was a faculty at a well-known university that, I just didn't want to deal with that. I knew that that was going to negatively impact my career if I did anything to speak up about that and try to address that. And so I ignored it, right? That's not necessarily the way that I wish I would have handled it, but it's what I did because it's what I felt like I had to do to survive that space and get to the end of the PhD program, right? And the other thing that I think we have to keep in mind with this is that learners are paying for the privilege to be used and abused and mistreated like this, right? Even if they, even if for some reason like their tuition is covered in some way or whatnot, like most people are going to be paying tuition to be in these spaces, but even if they're on full ride scholarship, there's still time, effort, and energy that they're having to like put in to be in these lab spaces. And that is a real cost. And again, the learners are having to kind of do this volunteer labor and be put into these situations because we as medical schools and other health professions are kind of forcing people into this research space. So if we're going to do that, then I think that we really have to think about, how do we create kind of safe passages for our students, especially for students in our communities that are coming with these diverse backgrounds that can really help us enhance medicine, help us address health disparities in our communities. And one kind of way that I've kind of come up with doing that is through the Power Skills Lab. As kind of seen here, the power comes from providing opportunities for workforce equity through research. And that's really kind of been the foundation of what we've been trying to do with this lab is create an opportunity for people to continue to move forward in getting research experience during some really challenging times. This originally kind of started out with our mission, vision, and values. These are being kind of updated by the lab currently as part of a community-driven process. But what we originally started out as was basically a response to the COVID-19 pandemic. There were students in the UNL Minority Pre-Health Association and students here at Ohio State, specifically some of the students in the Aspire program, who, because of COVID, because of kind of the shutdown of research opportunities, had their path towards medicine, towards being a healthcare professional, really like thrown off track. Because again, there's disparities in who's getting access to these research opportunities. And as the number of opportunities decreased, the disparities between groups of people increased, right? And so as a response to that, this lab was created to try to come up with a way to make sure that some of our students in our communities that, we are getting so close to the finish line in really getting into health professions programs, had the research experience that they needed to make it to that next level. The other thing that I really kind of started this off with was wanting to make sure that I wasn't just giving people research experience, but that I was really giving them skills and tools that they could take to the next level to be leaders in healthcare, be leaders in their medical school, hold their medical school administrators accountable for, following through on the promises that they make to their students. This is something that, I've tried to do my entire time here at Ohio State. If you're going to make a promise about being a place that is focused on diversity, you have to follow through and you have to back that up. It is not okay to have students feel like they're bait and switched by coming into this space, right? We have to follow through with that. We have to back things up. And I'm working on training leaders in this lab that are going to have the tools to hold leaders accountable so that when they are coming into this space, they can continue to push and address these things. This has been a team effort. There's been a lot of people kind of involved in this from the beginning, kind of in large and small ways. That's included Shane Scott here at Ohio State. He's one of our MD PhD students. Aaron Thomas, obviously, some students from the Aspire Medical Research Program, the students from the Minority Pre-Health Association at the University of Nebraska, Mariana Burks, who is their advisor at the University of Nebraska, my college mom, Karen Kassabaum, who was at the University of Nebraska and is now in South Carolina. And then my team that has been willing to kind of step up and be supportive of me and provide the technical support for these efforts from University of Nebraska, or not from University of Nebraska, from SUNY Upstate, Jeremy French Lawyer and Reed Flanders. They've all helped to provide some additional support for me as we've been going through and really tried to create this lab and make it work. The other thing that we have really tried to do with this lab is create this kind of horizontal power structure that really focuses on the undergraduates and making sure that they are really the center of this entire kind of decision-making enterprise. And so, what you'll see here is that there's the technical guidance team, which I am a part of. Jeremy French Lawyer has been a huge part of that team as well. We've worked together to really make sure that the technical expertise is in place to help the students not only, build a really solid research project and start executing a really, I think, innovative and cool product, but also making sure that they have the leadership kind of skills and the training that they need to build a healthy, sustainable organization. We've also had students that have participated as part of the founding peer board, who actually, were members that are pre-health students that were not necessarily participating in the research part of the lab yet, because they were helping us kind of get started and kind of develop our bylaws. But they played a really critical role in helping to identify the initial set of research assistants that are going to be in this lab. Everybody that is in this lab and in this space is kind of come into this space because their peers have elevated them to this position and given them this opportunity. And I have felt like that's a really important part of this process. There's some really great leadership skills that the students are getting to develop around trying to figure out how do you create a fair and equitable way of selecting people to have this opportunity. And it also kind of takes me out of the position of being the one that's making those decisions. So again, we can have a more horizontal power structure. One of the things that we haven't done yet, but is part of the future of this lab, is really partnering with faculty members on the topics that we're going to be doing the systematic searches and reviews for. There's not a lot of diversity in who is able to have access to the resources to complete really high-level systematic search and review studies. And so I do want to make sure that we're helping to diversify this field by partnering with faculty members from diverse backgrounds to do systematic search and reviews on topics that they're passionate about, and helping them contribute to the literature that they're connected to in that way, while also helping our students elevate somebody that can be a role model for them and that looks like them, and helping our students, demonstrate to themselves that they have a very valuable skill. They have the ability to kind of help other people be successful because of what they're learning to do in this lab. In this lab, there's multiple roles. Currently, we have an OSU lab manager, we have a UNL lab manager, and we have a project manager. The students that are in those three positions have done an incredible amount of work to develop our first research project, which is focusing on barriers students with disability face in getting to and through medical school. Our lab has expanded to now also have a data manager that's helping with this, because systematic search and reviews have a lot of data that has to be managed. We have evaluation and development specialist that is really helping us, reflect on what this lab is doing, capture kind of what's going well with our process, what's not going well with our process, and focusing on kind of helping us change our process, connect with our communities in better ways, and again, kind of be the product and lab that we want to be. We also have our research assistants who are obviously helping to really drive forward a lot of the work in this lab and make everything that we're doing possible. So there's some key features of this design that I think are really valuable. First, it does kind of check that box for providing students with a quality research experience, but it does so while focusing on personal and professional development. It empowers students to overcome personal and professional obstacles by allowing them to exercise adaptability and ingenuity. Every student in this lab is required to put in 7 hours a week as part of their kind of research contribution. That includes our meeting times. But they have the flexibility based on the type of work that we're doing and how this lab functions to put that time in when it works for them. And if something comes up in their life and they need to push that time to another kind of point in the future, they're more than welcome to do that and kind of adapt and kind of communicate with us so that we can all work together to make sure that everybody's staying on track, the research project's moving forward, but there is flexibility built in so that it can be adaptable to kind of their lives in the ways that they need it to be so they can stay engaged in this experience. The other thing that it does is it provides access to resources and support. I have a lot of experience mentoring pre-health students that are going into a variety of different types of health training programs and even graduate training programs. I've worked with admissions in a lot of different types of graduate programs. And so they just, at baseline, have access to me, but they also have access to my entire network of friends and colleagues that are able to help them kind of move forward and develop. They also, have access to one another and are able to kind of draw on one another for support and insight. And as we continue to develop this lab, we will have generations of students that will be able to continue to kind of reach back and support their peers kind of through this lab. And then the other thing that it does is it really focuses on building these leadership and organizational skills by having students have to make these kind of core organizational decisions at every step of the process and have to kind of navigate the complexities of developing a research project and identifying partnerships. It helps students kind of practice building these leadership skills, and it trains them in things like program planning and evaluation. It trains them in how to do SWOT analyses. It trains them in the importance of mission, vision, and value statements and how to go about constructing those in a community-driven way. All of these are skills that they can take forward with them once they leave this lab to go out and do effective work on their own in their communities. And and that's kind of like the final piece of this is it provides a training ground where people can take swings at things. They can try things out. We can, have things that don't work out, and that can all be fine, because at the end of the day, nobody's job, career, whatever is really like tied to a certain volume of research output or anything like that. The entire focus is on the process and helping students be very good and effective researchers, treating them how to think very critically and how to execute a protocol that's very rigorous. But it's also about helping them, kind of spread their wings as leaders and work on applying some of these leadership tools and like understand what it takes to drive an organization and learn from lessons that we're learning in terms of what's working as we move our organization forward and what's not working. We recently did a SWOT analysis as part of, again, our kind of evaluation kind of cycle and kind of moving our lab forward and kind of developing us. And one of the things that I think is really important to point out in terms of the strengths that our students identified is that, what this lab is helpful for is it not only explains how to do things, but really the why behind that. And they, said that this really allows them to have a deeper understanding and feel more invested in what it is that we are doing as a lab. They also feel that because of the type of environment that we've created, everybody has a positive kind of uplifting attitude, and it makes it so that it's a type of environment that they want to be a part of and they want to engage in. The flexibility really allows our students to, kind of adapt to that their undergraduate experience and kind of deal with juggling the multiple, things that they have to do to become, qualified pre-med students, pre-health students. It also, kind of gives them an ability to feel comfortable asking questions, get timely responses. We're able to be very quick about making decisions and finding solutions. And it helps everybody in the lab appreciate one another's skills, background, and experiences so that we can all really learn from one another and see the value that everybody brings to the table. There are weaknesses that we have that we're going to be working to address, again, as part of this kind of learning and development. One of the things that kind of came up was that the peer board, did not function quite as envisioned. And so we are going to be rethinking that a little bit, but it did do a lot of really effective work in helping us get this lab started. It is obviously harder to develop relationships with people online. There's students that are currently at Ohio State or at UNL. Jeremy is at SUNY Upstate. And so, not everybody can be in the same room and interact with one another. And there are some challenges in kind of being in a completely digital environment. That's, again, something that we're continuing to explore and kind of develop. There's just kind of the overall challenge of coming in blind to kind of systematic search and review research. It's a really, there's a really steep learning curve in learning how to do that stuff well. There's even a lot of scientists that don't know how to actually do this stuff well. And so, for undergraduates, it's kind of a lot to kind of take in and do, but the students in this lab have been adapting to that very well. And I'm watching them do really cool and innovative work kind of in this space as they're learning to do this. And then the other challenge is, as pre-health students with, with all this stuff on their plate, because they are coming from these, kind of diverse backgrounds, they've got a lot of kind of barriers that are being kind of in their way. There's a lot of things being thrown at them. It can be a lot for students to have to think about things on an organizational level all the time. And so that is something that, some students have expressed is kind of uncomfortable. And again, that's something that we're going to try to work on addressing as we move forward. But in terms of opportunities, there's a lot of opportunities that have really come out of developing this lab. There's a lot of outside interest in our training methods. We're working on developing some relationships with our library, some other institutions and companies based on what it is that we've been doing and kind of their interest in how we've been able to be kind of effective with what it is that we're doing. It gives the students the opportunity to actually, see how work that they're doing can be applied in practice to do things like influence technical standards that are at medical schools. I strongly hope that the product of this first systematic search and review really pushes medical schools to reflect on the barriers that they're putting in place in terms of allowing people with disability into these spaces, and making sure that we're actually having the healthcare providers trained that we need to have trained so that we can be responsive to our communities. We also have future RAs who are going to have colleagues that have already kind of been through this type of experience and are going to be able to be resources for them as they come into this space. So, this is kind of the first year of really being up full speed with the lab, having everybody kind of clicking on all cylinders, having such a large group. As we move forward, we will then have generational knowledge that we'll be able to pass on to one another and be able to help develop one another even more effectively. There are some threats. One kind of key threat right now, which has kind of been, intentional in a lot of ways, is kind of loose affiliations with academic institutions. We kind of sit in this space of being affiliated both kind of with University of Nebraska and kind of with the Ohio State University. Again, that's been intentional because I've been trying to find, a space that we can exist in where I feel like we have partners that really align with our values and what it is that we're trying to do. But that is something that obviously we'll have to formalize moving forward if we're looking at getting funding and we're looking at doing some other things that require, kind of more formal kind of academic institution affiliation and partnerships. Because we kind of exist in this space, because I'm a medical student that is, doing this thing, there is this risk that we're not going to be taken seriously. I think the work that we will put out will speak for itself, and I'm not actually terribly worried about that part of things, but it is a thing that is a potential threat for us. And then again, because we're functioning kind of outside of these traditional funding and institutional structures, there's just, again, kind of challenges in setting up a research enterprise and making sure that we're doing all of the things that we want to do, which includes making sure that our students are getting paid for the research that they are doing. They're contributing really valuable time, energy, and work. And I really think it's important that they're getting paid for doing this, because that would also help to reduce some of the barriers that they're facing. But again, that's not something that we've been able to do right now because of kind of how things are working. In terms of future directions, we're focusing really on further evolving and developing the lab structure and its resources and policies. Like I said, we're kind of going through a cycle of evaluation, review, and revision right now as kind of a lab community. And we're going to be making some changes over the next few months as we kind of get ready to bring in our next round of research assistants into this space. As part of that, obviously we're looking to grow this lab community. So if you are a student that's listening to this presentation and this sounds like a lab that you're interested in participating in, do please feel free to send me an email. I'll have my contact information at the end of all of this. But we do want, motivated students that want to be part of this type of change in this space with us doing this work. And so that's something that we're, again, going to be pursuing as we continue to move forward. We're also going to be focusing on leveraging kind of our group skills and experiences. A lot of what we're starting to do now is really kind of take stock of the skills, experiences, and resources that everybody in the lab is bringing to the table, and trying to find ways to make sure that everybody has opportunities to shine and kind of bring those things to bear for this lab so that we can, again, kind of create a community space that is the product of all of us. Even this presentation, I cannot take credit for how great it looks because one of my people in my lab manager actually went back through and used his design skills to make it even better than what it was originally, right? And that's one of the things that we kind of keep seeing in this lab over and over again, is together we can create these products. They're even better and even more effective than if we were just trying to do these things alone and not kind of utilizing the skills and experiences that everybody brings to the table. The other thing that we're looking to do is really develop and nurture partnerships. We've been very fortunate. Again, my lab manager, he's been doing a lot of stuff. He has done a lot of work trying to find the right software packages, trying to find the right ways to kind of have this lab exist in a digital infrastructure. And as part of that, he's actually been working directly with the folks at Pico Portal, which is an innovative software package that focuses on supporting researchers doing systematic searches and reviews. And I've been excited to be able to talk with some of their leadership as we kind of, have conversations about what a partnership together, for us might look like moving forward, because we've been able to do a lot to help them, kind of refine their product and make it really be something that is state of the art and is able to help, support this type of digital infrastructure in a really effective way. And so again, there's lots of opportunities out there. There's lots of people that I think like what it is that we're doing, how we're going about doing it. And so there's a lot of different opportunities for partnerships. There's other institutions that, again, every institution kind of has some history that makes it so that they, have not necessarily been doing best in the diversity space. But, we're looking for partners that are really trying to change and be different moving forward and create opportunities that are really unique for people. And, that's something that we're very open to as part of this lab, is finding partners that align with our values, that we can work with, that we can affiliate with, so that we can be everything that we want to be as a lab and as an organization. And so that kind of gets to the last part, which is really, identifying a long-term academic institutional partner. I would love for it to be here at Ohio State. There's been a lot of issues that I've spoken about in the past. I'm not going to rehash today that I think kind of give me a little bit of pause with that. Unfortunately, I was hoping that having a new dean of College of Medicine come into this space would help to change some of that as well. And I think it's improved things. But there's also been a lot of demonstration from our leadership that there's a lot of room for growth, and that people did not come in being completely ready to deal with the challenges of this space and be able to lead effectively. And so, there are some things that, raise a lot of concerns for us in this lab, especially for myself, being a student in this College of Medicine, that make me give a little bit of pause in whether this is going to be the right partner for us moving forward. Again, we'll see. It's not ultimately my choice. It's the choice of the students in the lab, and they will kind of have the final say on who our partners are. But there is reservation that I have with how some things have been dealt with, especially recently. And so that's, again, a kind of future direction for us. The other thing that I want to kind of hit on as I'm wrapping up here is just overall, I want to emphasize change has to be something that's a community effort. I don't believe there's a single model that can really meet all needs. So I'm doing what I can do with the resources, tools, and kind of people that I have access to create a space that I think is, something that is very helpful for our learners and going to help move them forward. But there's lots of different ways of going about doing this. I think what Aaron has done with Aspire has been visionary. He's been doing this a lot longer than I have. He saw the need for this a long time ago, and he's been working extremely hard to make this thing come into reality and make sure that students are actually getting paid to do research experience, that there is a community of support around them, supporting them in this space. It's getting them into kind of traditional medical research labs so they can actually be in those spaces and have those types of experiences. I know that, I'm part of kind of the kind of executive leadership committee for that now, and there's conversations about kind of making sure students have access to other lab spaces as well. But again, I think it's really important to kind of recognize that Aaron's found a way to kind of provide some infrastructure to help support students, even with some of these more traditional lab models. And so again, there's lots of ways to do this. I think what we're doing with the Power Skills Lab is just one way to do this, but we as a community really have to be thinking about how we can leverage our positions and resources, create these kind of safer passages for students as they're trying to get towards healthcare and get towards medicine, because we're going to, have these policies and have these practices that require students to do research experience. We need to make sure that that is not standing in the way of us having the healthcare providers and people in these spaces that we have to meet the needs of our communities. If we're going to address health disparities and really effectively make change in our communities happen, we have to bring in people from our communities that know their communities, that can provide the service to their communities and the linkage to their communities that they actually need. We have to stop believing that we're just going to train some sort of workforce that's going to swoop into these communities and help. No, we have to empower people in these communities that want to be in healthcare to be here and do this work effectively. to address that, there does need to be innovation in funding and partnerships. Some of you that I've invited to this talk today are in positions at private companies, you're in positions at funders, you're in positions, kind of in kind of the hierarchy of academia and research that are able to really have influence on how we are kind of constructing our funding mechanisms and what it is that we're actually putting our money towards. And what I want to emphasize is that this lab runs really effectively, basically with no funding right now. Think about what it would do if we actually had funding, right? Like if we actually had the resources that we needed to pay students and have more of the infrastructure, more of kind of the additional resources that I would like to have for our students, we could do amazing things. And we're really cheap to fund, right? Like the type of research that we're doing is extremely cheap to fund. It costs basically nothing to do the types of research that we're doing because it's built into a lot of institutional costs already. The main cost is really our access to libraries, and that's paid for, right? And so, again, it's something where I think as funders and as kind of leaders, we have to be thinking about, what are we doing to support innovation in this domain? Are we putting money towards really helping people come up with these alternative types of models for training? And then with that, I think it's really important that the community strengths, resources, and opportunities are not overlooked. One of the things that I would love to do kind of in my future, once I'm done with medical school, is I would love to either have like a branch of this lab or another lab that's built in a very similar way that really focuses on doing community-based participatory research with students from the communities that we're trying to do the research with, and kind of use that as an opportunity to elevate the careers of students from those communities that have these needs, making sure that they're able to help, or making sure that giving them an opportunity to really advocate and elevate issues that are going on in their communities that we need to have better understanding of. I think there's a lot of room, especially in public health and medicine, for doing this type of work and being innovative and really kind of thinking about how we leverage who people are to really partner with our communities and help give them access to what they need to help us create some change in these spaces. And so again, I just think that there's a lot that we can do as a community if we come together and think about different ways of doing this and focus on our strengths and what it is that we have in front of us, instead of always kind of trying to force ourselves to conform to some different model or be like some other organization or institution. I think we have a lot of kind of inherent strength in ourselves. And so, that's something that I would like to see us focus on more. With that, I am going to kind of open it up for the last few minutes for some questions and comments. If I'm not able to address your question today, or if you want to reach out to me kind of privately or directly, my email is provided in the contact information below. I'm also on Twitter. The Power Skills Lab is now on Twitter as well. There's not much there yet. That will be a future thing that we work on, kind of building out to help highlight the work that we're doing and the students in the lab. But those are ways that you can get a hold of me and contact me. So with that, I do want to.
Yeah, the first question, Michael, is how do you recruit students to work in the Power Skills Lab? Or do your interested students just reach out to you directly? So if you could talk a little bit about how you have established the personnel in this lab.
Yeah, of course. So most of it has actually not really been through me. I worked with the pre-med or Minority Pre-Health Association, at the University of Nebraska-Lincoln. Their former president, I worked with her to kind of talk about what it is that we were doing, and she provided the information about the lab to the students in that organization, and actually invited me to speak and kind of talk about it so that they could learn about it there. But with our latest recruitment, with most of our RAs that we brought into the lab, it was really the lab managers that I had that were both here at Ohio State and at UNL that kind of tapped into the pre-health student kind of networks that they were a part of, and the different organizations that they were aware of on their campuses, and found they were the ones that constructed kind of the kind of call for applications, if you will. They were the ones that developed the application and what questions were going to be on it. And then they, sent that out and worked on recruiting. And again, there were kind of lessons learned about mechanisms that were more or less effective that we're going to take forward with us as we kind of do our next round of recruiting. But that was, again, kind of an example of, from the very beginning, students kind of being involved with that process. For the first 3 students that were really part of the core lab, the first 3 managers, again, that was through the pre-med, the Minority Pre-Health Association at UNL. 1 student, that's one of our managers, came from there. And then 2 students actually came from the Aspire program last year, when there, again, were some challenges with getting people into research opportunities. And so that's kind of how we started. And then from there, they've kind of helped us grow.
What would you say has been the largest obstacle you have faced in constructing the lab?
Yeah, so I think one of the largest obstacles is really, there's 2. First, an all digital infrastructure. I think that's given us a lot of opportunity, and I think it's the right call for us. But it is hard to build community in that space. It is hard to not be some sort of scary talking head, kind of in that space. And so that's, I think, been one key obstacle. So I guess maybe there's 3 obstacles. Another obstacle is just students coming into this, like hearing me talk about it, kind of knowing kind of what it is that we're trying to do, but then kind of thinking that it's going to function like a traditional research lab. And so there's kind of a hierarchy that people have to kind of get used to, that, we're really, like, I'm trying to really kind of eliminate a lot of that kind of hierarchy and power structure. I don't like I am the original kind of architect for the lab. I'm the person that kind of helped resource the lab and get it going. I provide technical advice, but it's not my lab. I'm not the one in charge of it. Yes, I will write letters of recommendation for people because my letters look good after my name when I'm writing a letter of recommendation for you, and that will help people get to the next level, right? But it is not my lab. I am here to provide feedback, support. I'm here to kind of watch people's performance and try to provide some sort of objective assessment of that, so I can, again, write these letters of recommendation and help kind of people grow and develop and move forward. But again, there's kind of that hierarchy that people are used to, that kind of takes them a long time to kind of break out of and kind of understand that is different. And then I think the last thing is just giving college undergraduates a lot of flexibility is both a blessing and a curse, right? Like I've watched students adapt to some really challenging situations. One student in our lab had one of their friends try to commit suicide, during this past semester. And so obviously he needed some time to kind of step away and deal with that. And he was able to do that and continue participating in the lab. We were able to, kind of provide that flexibility as a community. I've had other students that have had, family health concerns come up, kind of personal mental health issues come up. Like all of those things have kind of come up, and having this flexibility has allowed them to adapt, continue to be a member of this community, and continue to participate and get this experience. But that also kind of leaves room for this to get pushed and for people to procrastinate and not put in their time. And even this, part of the lab meeting tonight is kind of discussing that issue of, how do we hold one another accountable? How do we, move forward and make sure that everybody's putting in their time so that everybody's doing their fair share? And I was really proud of the students last week, on Thursday, that during their kind of meeting together without, any of the technical advisors involved. They had a conversation among themselves, came up with some really innovative strategies to kind of address that. And I'm looking forward to, seeing them try them out and implement them and learn from it, right? And so I think those have kind of been the challenges. But, again, I think there's also been opportunities built in with a lot of that.
All right, because we have 5 more minutes left, I'm going to ask you 2 questions to get it all covered. The first question is, what kind of research are you working on in the lab? So if you can kind of talk about what systematic reviews are, and then how can medical students get involved with the lab?
Yeah, so I'll address the how can medical students get involved with lab first. Reach out to me, send me an email, talk to me. Like, we're always looking for people that have skills that they want to contribute to this space, that can be, people that are additional resources and mentors, that can even just participate in, some of these lab meetings and provide additional kind of resources for students as, they're moving forward in their pre-med journeys. I can't give everybody all the mentorship that they would want or need, because I just don't, have the variety of backgrounds that we would need for me to want to be able to do that, right? There's a lot that I can do. There's a lot that my colleagues that are medical students can bring to the table themselves. And so that, I would encourage you to reach out to me directly, and we can, talk about finding ways for you to get involved, whether it's large or small, even if it's on just kind of like an on-call basis, if I have a student that I think would benefit from connecting with them. In terms of your other question, can you give that to me again, Aaron?
If you could explain what kind of research is happening
Yeah.
in the lab.
Yeah, so the research that we're doing in the lab, the systematic search and reviews, what those are meant to do is those are meant to synthesize all of the research that is published in the literature on a specific topic. So for example, the first project that we were doing that was really developed and driven by one of our students in the lab with disability that wants to be a medical student was on the barriers, kind of described in the academic literature that students with disabilities face as they're trying to get into the space. Because we suspect, we don't know, but we suspect that there are a lot of barriers that are not being addressed in the academic medical literature, right? This literature is written mostly by people in academic medicine that have kind of made it into this space, or not people with disability. And so, we suspect there's a lot of barriers that are not being addressed there, but we don't know, right? And so the first kind of part of understanding and knowing and kind of developing that part of our scientific understanding is collecting all of the scientific literature that have talked about barriers that people with disability face and trying to get into medical school, bringing that together, identifying themes in that literature, identifying the, kind of creating a list of different barriers that these things talk about. And then from there, we can start working on, where are the gaps? How do we, kind of help medical schools understand these gaps and provide kind of a framework for moving forward. And so when you create one of these products, like the science kind of research part of it is that synthesis, really having to do it in a systematic and objective way. And then, providing, a framework for understanding what it is that is found. And so there are some opportunities for, again, people based on kind of their understandings, their backgrounds, based on other kind of parts of literature that we can bring in to help kind of identify these gaps, so that as we work on creating the scientific literature in the future, as we do more studies, as we try to further develop that literature, we understand where the needs are for more understanding, more development. For example, from this type of systematic search and review, it would help inform, any sort of survey that we were wanting to do for pre-med students that have disability, and understanding, again, kind of the types of barriers that they're facing and trying to kind of holistically capture all of those. Because if you don't kind of think about them, if you don't understand where the gaps are, then you can't really include questions about those things in that type of survey design. They also help with informing policy, right? Because it's the synthesis of the literature, and it really helps to understand, where kind of the state of art in that literature is. And so I think that's another place that these are actually quite helpful and kind of impactful.
All right, that's the final question. Thank you, Michael.
All right. Thank you, and thank everyone for attending today. I am going to do a plug for Aaron's program just real quick for any pre-med students that are on the line, or pre-health students actually, here at Ohio State. The Aspire program is accepting applications, and so you can go to their website and complete that application there. And again, if you want to get a hold of me, my contact information is below.
Thank you so much, Michael, and thank you so much, Aaron, for your time and for the wisdom you've shared with us today.
Thank you.